Today our topic is scapula bone, which is a bone of shoulder region and is really important as it lies on the posterior aspect of our rib cage and is situated laterally on the posterior lateral aspect of thoracic cage. As you can see here, here are the ribs and this is the scapula bone. In our body there are two scapula and one pair. Here is a scapula and the other one is here. Now going towards its feature and side determination. For side determination, you will hold the scapula like this. These fingers will face lateral border and the index finger will face the spine of the scapula. If you will hold the scapula like this will be of right sided, and if you will hold the scapula in left, then it will be of left side. For instance, it's my left hand, and when you will put your hand on the scapula like this, it will be of left side. Here is the spinous process and your index finger will be on the spinous process, and the three fingers will be on the lateral border of the scapula like this. And it means on the posterior surface, that is the dorsal surface of the scapula, you can hold the scapula like this and can determine its side very easily. Going towards its main features, it has two surfaces, two tubercles, three borders, three angles, three processes and three fossas. Going towards its surfaces, it is the dorsal surface and the surface that is facing the ribs. You can see here inside, this is the inner surface or costal surface of the scapula. Now it has three borders: superior border, medial border and lateral border. It is the superior border. Here you can see this is the superior border from here to here, and this is the medial border. This is the lateral border. Now going towards the angles, there are three angles: superior, inferior and lateral angle. Angle means corner or edge. It's the superior angle, it's the inferior angle and it's the lateral angle. Going towards its processes, this is the acromion process, this is the spinous process. The process on the posterior side is spinous process and the process leaving the scapula is acromion process, and the process on the costal surface is coracoid process. Now we have three fossas. On the posterior side, it's a supraspinous fossa, infraspinous fossa, and on the costal surface it's subscapular fossa. Now there are two tubercles, one is supraglenoid and infraglenoid. It's a glenoid cavity where the head of the humerus is attached. On the lateral border, the first one will be the inferior glenoid tubercle, and on the upper side it will be supraglenoid tubercle. I have covered all the angles, borders, surfaces, processes and fossas of scapula bone. Now for further information and attachments, there will be another video. Stay tuned. Thanks.